हेलो एवरीवन, वेलकम बैक टू स्टडी। आज हम डिस्कस करेंगे दैट हाउ वन डिजीज कैन ट्रांसफर फ्रॉम वन ह्यूमन बीइंग टू एन अदर और फ्रॉम वन इंडिविजुअल टू एन अदर। सो द नेम ऑफ द टॉपिक टुडे इज द डिजीज ट्रांसमिशन। एक डिजीज जो है वो दूसरे इंसान या किसी जगह से किसी दूसरे से किस तरह से ट्रांसमिट हो सकता है। सो लेट्स सी। So basically the disease transmission क्या है? It is a passage of pathogen. Pathogen is any infection or infectious microbe or microorganism that can cause a disease, right? So causing a communicable disease means जो एक इंडिविजुअल से दूसरे में ट्रांसफर हो सकता है from an infected host individual or group to another individual. So disease transmission is the transfer of the disease एक इंडिविजुअल से दूसरे इंडिविजुअल में जो डिजीज फैल सकता है, that is the disease transmission, and it occurs when an infected person touches or exchange body fluids with someone else. So ये कब कब हो सकता है? जब आपका किसी के साथ कोई टच हो, जब आप किसी को हाथ लगाएं या आपका उसका लिक्विड ब्लड या फिर उसका यूज मटेरियल आपके कांटेक्ट में आ जाता है. सो बाय दिस देयर आर लॉट ऑफ मीन्स और वेज टू ट्रांसमिट अ डिजीज फ्रॉम एन वन इंडिविजुअल टू अनदर. तो एक इंडिविजुअल से दूसरे में ट्रांसमिट होने के कौन कौन से तरीके हैं हम वो अब डिस्कस करेंगे. सो फर्स्ट ऑफ ऑल वी हैव अ मोड ऑफ ट्रांसमिशन. इट इज एग्जैक्टली व्हाट आई सेड बिफोर कि एक इंडिविजुअल से दूसरे इंडिविजुअल में किस तरीके से एक डिजीज फैल सकता है. तो हियर यू कैन सी इन दिस पिक्चर दैट दिस इज एन इन्फेक्टेड पर्सन who is ill or who is not well, but when while you are shaking your hand with him, so what will happen? The infectious particles or microbes that can travel from his hand or transfer from his hand to your hand and can cause the disease. So there are a lot of modes of disease transmission that can include direct contact. You are in contact with the person directly, आप उसको हाथ लगा रहे हैं. इनडायरेक्ट कॉन्टैक्ट वो कोई टिश्यू पेपर हो सकता है, वो अपना यूज टिश्यू पेपर, टॉवल, पेपर, पेन कुछ भी यूज़ करके उसने रखा और आपने उसको यूज़ कर लिया, दैट इज द इनडायरेक्ट कॉन्टैक्ट. ड्रॉपलेट इंक्लूड्स द ड्रॉप्स, हिज ड्रॉप्स में while he sneezes, he coughs or he talks, so there are some droplets, there are some water molecules that can transfer or that when come in contact with you or are spitted towards you, they can cause the disease. And the airborne is actually when the air he breathes or the infected person breathes, there are some small particles in the air that can cause a disease. So let's see over here. So we have basically 4 basic modes of transmission of a disease, which include direct, indirect, airborne and droplet. So now the direct contact transmission is here you can see it is he's the infected person, right? So when the infected person is in direct contact with the healthy person, he can transfer the microorganisms or bacteria or viruses from one individual to another. The microorganisms are transferring directly, so this is a direct contact transmission. So what happens over here is that वो ट्रांसमिशन जिसमें हमारे पास डायरेक्टली इन टच है पेशेंट आपके साथ, आपने पेशेंट को हाथ लगाया, पेशेंट के गले लगे या पेशेंट से बात करते हुए उसके साथ बैठे हुए हैं, सो किसी भी तरीके से आपका कोई कांटेक्ट हो गया पेशेंट के साथ, सो दैट विल कॉज द डायरेक्ट कांटेक्ट डिजीज ट्रांसमिशन. सो डिजीज ट्रांसमिशन किस तरह से हुई? आप उसके साथ डायरेक्टली इन टच रहे थे. सो इट रिक्वायर्स अ फिजिकल कॉन्टैक्ट बिटवीन इन्फेक्टेड एंड सस्पेक्टेबल पर्सन, फिजिकल ट्रांसफर ऑफ माइक्रो ऑर्गेनिजम्स. सो विद द हेल्प ऑफ द touch, you are touching any part of his body or you are touching any you are having a physical contact with that person, with the infected person, can cause you the disease. So the examples of direct transmission involves a direct touch to an infected person. आपने उसको directly touch किया है, contact with the body lions, so there can be any lion in patient in the infected person. उसे कोई चोट लग गई है, उसे कुछ कोई भी प्रॉब्लम हुई है और आपने उसको टच कर लिया है, राइट? सो उसके किसी चोट पे, किसी भी उसके पार्ट उसके दाने में उसके कोई भी लायन थी, उसको कोई भी उसको प्रॉब्लम थी और आपने उसको टच करके आपने उससे क्या किया कि उससे जितने भी वायरसेस, बैक्टीरियाज और प्रॉब्लम्स थी वो आपने अपने साथ कॉन्टैक्ट में अपने अंदर ट्रांसफ़र कर दिया. सो नेक्स्ट इज अ किसिंग. इफ़ यू हैव एनी कॉन्टैक्ट विद द पेशेंट which is ill or who is infected, right? So these are the all examples of the direct transmission. Now we have other we have is an indirect contact transmission. In this example you can see that there is an infectious there are the infectious particles or there are microbes or viruses, bacteria or any other microorganism on the door handle, and when a healthy or suspected person touches it, these microbes will travel to the other person. So this is a indirect mode of the transmission. So in this transmission you don't need a direct contact to patient, but there is an other intermediate object by which you can get the disease. So what happens over here is that if any infected person has touched another object and you have been in contact with that object, it can transfer the disease from a object to the suspected human. So there we don't require any human to human contact, and Contact occurs from reservoir to contaminated surface objects or vectors. So there can be any reason or any object that is was contaminated, and after you touched that contaminated object, the disease has been transferred to you. So this is the most common mode of the transmission, because it is very easy for us. We all most of us avoid in contact with the infected person. We stay away or make a distance between them. But if a person is has used anything, we are unaware about it, and we just touch it, and the disease can, or microorganisms can, or the pathogens can travel from that object to you, right? Now example can include the contaminated gloves, sharing some medical equipment. It is very important. That is why sterilization is very important. If you have not cleaned or sterilized, the object after using the instruments, it will transfer the disease from one person to another. So it using the contaminated instruments, it is also very important thing. Next we have the airborne disease transmission. You can see here, these are the air, there are small particles or microorganisms in the air he breathes, right? He breathes out or exhales, because the patient may have any disease of lungs, so it can transfer the disease to you as well. So disease transmission, that is due to the droplet nuclei that remains infectious when suspended in the air for a long time. The most important example of airborne disease was the smoke, or is the smoke. You all know that smoke contains a lot of unhealthy or infected particles, microorganisms in it, and it can transfer and can travel a long distance, and the organisms can stay in the air for a very long time. So when the particles are in the air, they can transfer to anybody in the environment, right? So microbes are viruses and bacteria. There is no face-to-face contact, because the infectious agent has been transferred to the air. So we all breathe here, so we can get that infection very easily, can spread over long distances, as I have told you in the smoke. These tiny particles are expelled when person with airborne disease sneezes, coughs, exhales, or and laughs. So any droplet particle that has been a small droplet nuclei particles, right? The small air particles, we all know that air particles also have some small little microbes and other different type of particles. So when a person that was infected coughs, sneeze, or exhales, and we all have seen from that time was COVID-19. Coronavirus was also an airborne transmission disease, and others are chickenpox, common cold, whooping cough, and tuberculosis and measles. So next we have is the droplets disease transmission, where the drops, when a person when speaks, a person when when a person talks with you, the small water particles transfer from or are spitted from his mouth, or when he coughs or sneezes, there are a lot of water particles as well as the air droplets, right? So that type of transmission, okay, so that type of transmission is a droplet disease. And there are the droplet transmission in which the microbes are transmitted through respiratory droplets. The term droplet consists of water in with various inclusions depending on how it is generated, and its size is greater than 5 micrometer. As I have told you, it has some water particle in it, and it also has there are due to the respiratory disorders, patient coughs, or it he has he's while he talking, he spits any water droplet molecule, so it can transfer from one person to another. Example may include coughing, sneezing, suctioning, colds, and pneumonia. So here you can see different type of transmission routes. So if this is an infected person, if it is an infected person, so the disease can be due to the droplet nuclei, which was the airborne, right? Which was due to the air particles, right? The other way of it can be the water droplets, right? That was a droplet. And there can be a direct contact with the patient, with the infected person, and there can be an indirect contact, like you have used his any instrument, used his clothes or towel, or you have took his tissue paper, or any way indirectly you have touched his infected object, right? So it can transfer from one person to another. So how you can prevent it? You have to use, or you should use, disposable gloves. So when you have been in contact with any infected person, you can dispose the gloves, and the disease may not travel to you. Avoid sick people. You should not be in touch with it doesn't mean that you have to totally cut off them. You should avoid them. You should not have any contact with them. Minimize touching your mouth or nose with hands, right? So you are not touching your mouth or nose with the hands. You are avoiding the risk of infection, because we know that we touch a lot of things with our hand which may be disinfected, right, which are not sterilized, so which are not cleaned, so these can cause they can cause the transmission of the disease to you as well. Cover your mouth or nose while coughing or sneezing, and wash your hands afterward. This is an important thing everybody should do, right, so that the droplets or air particles may not spread or may not transfer from one person to another. So wash your hands again and again. Use a sanitizer. Teach children not to put hand or objects in their mouth, because we all know that there is a highest risk of transmission of a disease from children to the to the children, because children touch a lot of dirty objects, and that is why the microorganisms can travel from that dirty object to them. So it should be taken, there should be a lot of care for the children, that they don't put their hands in their mouth or any dirty object in their mouth. Airborne patients should be kept in separate rooms. This is very important. Like a patient with tuberculosis has been in isolation, so that the disease may not transmit to another person, you have to wear mask. Special ventilation system should be given. Follow respiratory hygiene. For multi-patient room, the distance of 3 meter or more should be kept between the beds, so that the risk of airborne or droplet diseases may be reduced. Environmental consideration is very important. Personal protective equipment means that you are using any other safety cloth or safety protection. For your protection, you are wearing you are having a dressing, so that you may be safe while you are dealing with the patients, right? So protect yourself and those around you. These are the precautionary measures one should take. This is all about today's lecture, right? So if you have any confusion related to the disease transmission, you can comment in comment section. Thank you so much.